Another focus of your research is autism and co-occurring conditions such as ADHD. What can you share with regards to this research?
I started doing that analysis on, first of all, on the association between autism and ADHD in my postdoc. And at the time, autism researchers really consider themselves to be autism researchers, and they went to the autism conference, and they were located in one part of the building. ADHD researchers went to ADHD conferences and worked in a different section of the building. And I was looking at what was known about the association between autism and ADHD, and there's hardly anything in the literature. And I thought, well, I'll do an analysis, because I had all these data where I'd collected the big sample of children for whom I'd collected autistic trait data. I'd also asked them about ADHD symptoms. And I didn't expect to find a strong association. These are two very distinct conditions. At the time, the diagnostic manuals did not allow clinicians to give a child both diagnoses at once. It was considered that if a child had autism, if they showed any ADHD symptoms, this was just a sort of secondary byproduct of their autism. So I did these analyses, and I was really shocked to find very strong associations between both autism and ADHD in the kind of clinical end, but also in terms of the traits often co-occur. And moreover, I found, using twin model fitting analyses, that the same set of genes, largely the same set of genes that were influencing autistic traits, also influenced ADHD traits. And this was kind of, again, a big shock. At the same time, another group in Australia, a paper by Angelica, published a similar finding on adults. And it's since become widely, acknowledged, and lots of different studies finding that autism and ADHD often co-occur and appear to have some of the same genes involved. And in 2013, the diagnostic manual, at least the American one, DSM-5, changed the rules. So a child can now have a diagnosis of both conditions, which one can only think must be helpful for families and the children to understand their behaviour, to understand their needs, to have both diagnoses.